Monroe County Cares distributes grants each year to local agencies who work to reduce substance use in the areas of prevention, education, intervention, treatment, and justice. Just so everybody knows, the grant applications for 2024 will be released, supposed to be released in March. I don't believe we're going to get there. It'll be the first part of April. If you're interested in applying for CARES grant, you should contact Lisa Muser, our CARES Board Coordinator, at llmeuser@me.com. And Monroe County Cares is the local coordinating council for the Governor's Commission for a Drug-Free Indiana that was established to coordinate, support, and promote local efforts to prevent and reduce harmful involvement with alcohol and drugs. So we have some CARES board members, some community members here this evening too, so welcome. I know we have some that are online through Teams, watching through Teams, and Katz is also recording this. Thank you, Katz, for doing that. I believe it'll be available on their website as well. So thank you. As we get going here, I just want each of you to introduce yourself, your role, explain what the program is you represent, what you do, and the population you work with. Kathy, we'll let you go first.
Hi, my name is Kathy Green, and I'm here as an Alateen sponsor. So Alateen is part of Al-Anon family groups, and that is for anyone that is dealing with a family or friend who has an alcohol use disorder, or for the Alateens, that can be also anyone with a substance use disorder. It's not for kids with substance use disorders, but they're the ones that are living with family or have friends that are dealing with issues related to drugs. We meet weekly here in Monroe County Public Library from 7:30 to 8:30 on Wednesday nights in room 214. We had met on Saturday mornings at 9 a.m., which really wasn't ideal for teens, so we decided to change it to an evening with a more central location. As a sponsor for Alateen, I've been involved for several years with the kids, and it's a program that you have to go through training for. You also have to go through background check annually, and we have at least 2 sponsors at each meeting. So we try to make the kids feel safe. They've nicknamed the group the Safe Group, or actually it's the Safe Group, yeah, for kids. And I find that having kids come is sort of a little bit like herding cats. So we inspire them to come as often as they can. They have really blossomed. They are ranging in age from 12 to 19. And it's in a program where they can feel safe to talk about themselves. They also bring us their life problems, and we have a period of time we call Happy Crappy, where they get to share, good things and the bad things. And as a member of Al-Anon, which is, also the parent organization that helps people deal with family or friends dealing with alcoholism, I've been in the program for 25 years, so I am kind of a veteran, being able to having grown up with alcoholism in my family, and then lo and behold ended up marrying an alcoholic who later succumbed to the disease. So I've found that Al-Anon has saved my life. It's helped me learn to deal and live with active alcoholism and help just try to change my attitude and my behaviors and choices to live a life that's a lot better than it would have been. And I try to bring this experience, strength, and hope to the kids. We're not there to solve their problems. We're just there to listen to them and to make them feel good about who they are. And they will bring us all kinds of things, and we help them try to find solutions. But we don't necessarily give advice. And we teach them about the alcoholic, what it is to have that disease in your family, and what can you do about it, and where there might be some resources if they do need that. So it's, I think I said for kids 12 to 19, and we also have taken the youth to their convention, which meets annually in the summer. So we go, it's the surrounding states where we're allowed to come together in a different state every year. So we are with each other over the weekend, and they're with other kids with the same situation that they're in. And so they have regular meetings, and they work on different projects while they're there. And it's really been rewarding. Initially, I wasn't so sure that I was cut out for this. It's kind of a big commitment, but the kids really have responded well, and I feel like they've grown a lot. And I just feel really, really fortunate to be part of their lives and for them to have an adult that they can come to and talk to. And so I think that's about it for me.
Good, thank you. Lisa, I'll let you go next.
Sure, good evening. Lisa Greathouse, I serve as the manager of coordinated school health. And for the past 8.5 years, that has been primarily through IU Health Bloomington. So out of their community health department, I've worked with public schools on all things health and wellness, pre-K through 12. So working with the school's staff, administration, students, and teachers on whatever it is they're willing and ready to do. My kind of elevator speech is we work to create healthier environments for both students and staff. So making the healthy choices the easy choice. Alcohol, tobacco, and other drugs is a big part of that. And then within this past year, I've also been able to work alongside the Monroe County Health Department. So through some specific state funding, I now am employed, kind of contracted through the health department to serve both the public as well as the private and charter schools as well. So expanding our reach, our capacity to help all schools, to make sure all students who go to school here, right, in Monroe County have the capacity to learn the skills that they need to do to live healthy lives, to build that health literacy, and have opportunities to program in as well.
Thank you. Amanda?
Hello. Amanda Van Leeuwen. I'm the local officer for the Department of Child Services. I've been working with youth in some type of capacity for 17 years. So I've been with DCS for 10 years of those. So obviously we investigate use and neglect, and a lot of the things go hand to hand with a lot of the community groups that we have. The population is from newborn to 17. 18 really, and sometimes we can go out to 21 depending on a program that I've seen an uptick in substance use from kids. But our role is to ensure that kids are living in a safe and healthy environment by supporting their families, providing them with resources. I'm working with a lot of community groups to try to really be more reactive and proactive than reactive. A reactive agency. I really like some of the community groups that I'm part of, like pregnant moms. We were just trying to really educate. I think that's the big piece on what our role can be. It doesn't always have to be a negative experience with children and families. So really trying to work with those other groups to provide education and prepare families for if they do have involvement with us.
You're trying to be proactive, and I think typically when you hear DCS, it's a very negative type words where this is concerned, and I appreciate what you said about being proactive, and it's truly not, so thank you for that. So, okay. Leah.
Can you hear me? Yeah. Okay. My name's Leah. I actually work for Overdose Lifeline, located in Indianapolis, and we are in Indy, but we serve the whole state in different capacities. We also have training and educational resources online that are in, I think, all 50 states at this point, that our people are using our training courses. And so Overdose Lifeline as an organization was on the forefront of the opioid crisis, working on reducing shame and stigma and promoting harm reduction. So that's a lot of like our origin story and sort of the beginning of our work. If you've seen in the Locks box, if you've accessed Narcan in most of the communities in Indiana, they probably came from our offices. But I'm here today really talking about our camp program. Camp Mariposa, it is a national program, and we run 2 camp locations through Overdose Lifeline, one in Indianapolis and also in southern Indiana. The camp site is located in Mitchell, but we serve pretty much anyone in the southern half of the state who can get to the campsite, and several of our families come down from Bloomington. We have one that comes up from Evansville, over from Elizabeth, and now a couple in like closer to the Bedford area that we're in. the camp serves kids 9 to 12 who have been impacted by a close family member's substance use disorder. And we really focus in on that 9 to 12 age is what makes it truly a preventative program. And we also, although it's called camp, we really talk about how we're more a mentoring program than anything. And camp is just the modality in which we utilize or like execute that mentoring program. So we meet 6 times throughout the year. They come to 6 overnight weekend camps. We serve kids, they can come and starting at 9 and go all the way through 12, so they could stay with us for up to 4 years. And our hope is that they would come to all 6 camps each calendar year. And then it would be the similar mentors from year to year, from camp to camp. So they're really like building those mentoring relationships with the mentors who come to camp. We focus in on that 9 to 12 age range, again, just working, you know, hopefully before that like 13 and up, where they get a little bit more experimental with drugs and alcohol, just in substance use in general. And also knowing that they have a genetic environmental component to their risk. We're working with on those things with them. So we actually borrow some, I think like Al-Anon curriculum a little bit. We call it the 7 C's because we've added some, but it's the first 3 that they use. Like I didn't cause it, I can't control it, and I can't cure it. That's kind of where we start with all of our kids. And then we build up from there, trying to, build up their healthy coping skills. So we have 4 more C's that are all positive things, what they can do, what they can control. What else to say? I think trends, if anything specific, really, it's hard to say. I feel like in our line of work, it's kind of like everybody knows somebody, right, that struggles with substance use. And so for our kids, it's really about getting in there and providing them some of that education and trying to break the generational cycle that tends to happen with the disease of addiction. So trying to prepare them for that and helping them build those coping skills that they can have and have tools for.
Thank you.
Yeah.
Okay, and again, thank you, the 4 of you, for being here tonight and taking time out of your busy schedules and being a part of this panel for us. I have a few canned questions that I want to discuss with you all, and if anybody here or online has a question, please feel free to let us know, and we can get what their expert opinions are or knowledge on this is, okay? So I'll go through each one question, and let all four of you respond to it, okay? What are the kinds of trends you're seeing in the county regarding the youth that you work with? Kathy, I'll let you go first.
Well, the youth that we work with are all experiencing difficult family situations. Obviously, they're dealing with alcohol use disorder or substance use disorder, and their challenges are about everything you can imagine. They're coping with mental health issues, a lot of them. They're struggling with just anything related to peers these days with kids, I think, is really a difficult for them to be able to communicate effectively and to try and be their authentic selves. They're learning a lot more about that. But they have school problems, and sometimes it's hard for them to maintain attendance, and they can have eating disorders, and low self-esteem tends to be part of the whole issue for them. And I think mainly just feeling like they belong. And for me, that's the biggest part I feel that we can provide them, is just to let them know that it's okay to be them, and to talk about situations that, I grew up with it and we never talked about it. And so I think having a safe place to talk is really an important, that they're not the only one, that they're in a situation that other kids are coping with, and that they can learn things to do that'll make their lives better. And just to listen to them talk is huge in my mind, because they're not feeling so isolated, and they're able to really confront things that they probably couldn't have otherwise.
Good, thank you. Lisa?
I want to take kind of a step back since I don't work with particular groups of kids or clientele. I was going to just kind of speak to use trends and what things we want to keep an eye on from our county, from our state level. So there's two opportunities for Indiana as a whole to gather information on youth trends related to behavior. One is the Indiana Youth Risk Behavior Survey that's administered every other year, and they do a random sampling across the state. Another one is locally through our Prevention Insights at IU. They do the Indiana Youth Survey. That as well is every other year. Those are both things that we need our schools to say yes to do, because if we don't have enough schools opt in, at least with the YRBS, we do not have state data. And so we had success the past couple years with our Indiana schools, but before that, we had about a 5-year gap where we had no idea what was happening because not enough schools were opting in to take those surveys. So I think a holdup with that is some schools get nervous about the topics that are asked on there. It's all things, but there's maybe more sensitive topics they may be a little bit nervous about. But what we see when we look at the trends from both surveys, 2021, 2022 figures, overall, use compared to previous years is trickling down. So when we look at things like vaping and tobacco, for the most part, compared to 5-10 years ago, they're reporting that they are using less. However, when we look at the grade breakdown of who says that they've used whatever substance, whatever it's alcohol, marijuana, tobacco, prescription drugs, of course, each year in their secondary schooling, those numbers go up. As their lives get more stressful, as they get more independence, maybe more access to those as well. The only type of substance that does have a spike beyond kind of that normal trend of like 7, 8, 9, 10 as they get up is prescription drugs. We see a bigger spike in 6th grade. And my own speculation is a lot of times that's when they go into middle school, right? Maybe it's a new building, new sets of kids, they want that sense of belonging, and life just gets a little bit harder and maybe more risk-taking is occurring in general. One reason I think we are seeing kids use, right, we know a number of underlying factors, but we also ask them, something along the lines of perceptions of peers using. Do you think your peers are using these substances? And that's where there's this wonky misconnection. They think everybody is, when that's just truly not the case. So when you pair that with kids who can't make great decisions on their own, and they have this perception that it's the norm to do it, you might start to connect the dots why they think it's maybe okay. We also ask them questions around how harmful do you think this type of drug or substance is? How risky do you think it is? How risky do you think your peers and parents and adults think it is? And we see, again, that misconnection. They think things like alcohol is a big risk and a big deal, but sometimes things like tobacco and marijuana aren't that big of a deal. It's not as risky. So I think the more that we can do from the prevention side of things, the schools, the community, the youth serving organizations, educating on kind of that peer perception, what are the norms, and really just get them to make their own best decisions for their health and not be leaning into what they think their peers are doing or kind of giving into that peer pressure. So I think that's one thing to keep in mind is as we're having conversations with our young people, reiterating not everybody is doing this. You might hear about it a lot. Things like social media skew our perception, the media they consume in general, and the friends they hang out with. You know, we see that with any risk-taking behavior, whether it's substance use, not wearing a seatbelt, engaging in sexual behavior. A lot of times teens think everyone else is doing it, so why is it a big deal, right? I should just get it over with, I should just try it. So, putting their own kind of internal pressure on themselves as well. But then when we ask questions around mental health, we have a lot of kids not doing well in our state, and these numbers are exacerbated by post-COVID effects. And so I think 2021 figures for the middle school, about 31 to 35% report feeling sad or hopeless for 2+ weeks. That's a horrible place to be in when you're a young kid. Anyone, right? None of us want to be in that place. At the high school level, that jumps to 36% and higher. And so again, kids going through life stages, other things happening, they're feeling sad or helpless, there's no light at the end of that tunnel, and then pairing it with things maybe around social norms and access. It's kind of a recipe for disaster. So making sure that we are not looking at substance use in a silo and recognizing we need to treat the whole child, the whole person, and there may be some other mental health, social emotional things going on that we can equip them and build up that skill so they are less likely to turn to these substances to numb, to get out of their own head, to fill their time, right? So I think Monroe County, we don't have specific data on reported use. For the schools that do partake in the Indiana Youth Survey, they have the option to get their school level data. So the schools that do that survey do have that option to have their own data. And I've worked with some of those schools to analyze their data and give them recommendations based on that. So if you are seeing, for instance, on the state one, not locally, we ask about first age of use. That ranges from 10 to 13. We can't wait until they're in high school to start having these conversations, right? It's never too early, and it's never too often. So we need to back up our prevention efforts to make sure it's aligning when kids are reporting when they are first using. So making sure we always have schools partaking in those data collection is really, really vital to get a better pulse of what's happening here and across the state as well.
Okay, so just to follow up on something, so some of what you were saying kind of resonated with me. Can I assume, I'm going to assume, this is no different than adults with some of the trends you're seeing where with social media and pressure and so on and so forth? Is that, I mean, from what I heard you say, that sounds pretty
Absolutely.
similar to the adults.
I think a lot of our young people have skewed perceptions of reality in general, and I know that sounds really harsh, but when you're constantly comparing yourself to others and filtered lives and looks and people, on top of that, they're probably gaining access to different avenues of obtaining these substances. I think it's just scary, the world that they live in. I would not want to be a teenager because that was hard enough without technology and a pandemic. And I 100% agree. I think the caveat there is we adults have developed frontal lobes. They do not. They do not have that impulse control, the decision-making ability because their brains are not fully developed. And so you can't look at your young person or your teen and say, why can't you figure it out? You should know this. They physically do not have that capacity yet. We have to help build those guardrails to get them to that point of fully developed brains so they can make better decisions.
Okay. Thank you.
Yeah.
Okay. Amanda, I'll let you respond to, do you?
I got it here. So what we're seeing a lot of is, and it's been like this, is like kids are in different roles in their household. They're either caregivers to their siblings, they're caregivers to their parents. This increases their stress, their anxiety, their ability to go to school because they feel like they have to stay home. They're getting exposed to a lot of things in the home, mental health, drug use, and it all goes hand in hand, and that's why I'm glad we're all here to talk about, because it takes a community effort to work through all of these things that these kids are being exposed to. They're being trafficked, and I know that that's a word that we don't like to, or we don't talk about a lot, but kids, there are parents, there are kids that are being trafficked for drugs on a regular basis in our community. And sometimes I think we don't recognize that. Kids are being raised by their grandparents, their great-grandparents. So they're living a life that's a lot of us aren't really accustomed to or really understand, because they're struggling with self-identity. They don't know who they are, who they want to be. The mental health is getting younger and younger from, I have 5 and 6 year olds that are struggling with mental health, and that's, you may say, how do 5 and 6 year olds? They do. They struggle with their mental health, their impulse control, their ability to really regulate their bodies and respond in a way. They're almost kind of like maintaining in an infant state sometimes when they're trying to express themselves, because they've not been taught or something, or that's not been modeled for them a lot of times. The parents, unfortunately, it's hard. We have high rent in Bloomington. We have a lot of things that are against parents that are really trying. And there are a lot of parents that are, I will say, really, really trying out there. And that's why I say I wanted to be proactive, because even though there's single parents, single mothers, single dads out there, and they're trying to do their best, but a lot of times that they don't have a choice though to choose to go leave their kid with, because childcare is expensive. So they're leaving their kid with their friend. Sometimes their friend's using drugs. That happens, and so they're exposed to that. Or they're with their friends, and their friends are, talking about using drugs. And it's that peer pressure that they want to fit in, just kind of like these ladies and what they said. That's really, we're seeing a lot of that. We're seeing a lot of drug-exposed born infants. Parents, mothers out there, although, and some of these individuals are addicts that are able to function and hold jobs. So it's not like they're out there, like we see on the videos, not able to function. But we have functioning addicts out there that are trying to raise their kids. And trying to do what they need to do, maybe trying to quit. And I work with Lori a lot, and we talk about this on how do we work with those especially pregnant moms that are in that cycle and they want to get out, but how do we work with them and knowing that DCS is going to come knocking on the door because they're going to have a child that's exposed to drugs, but how do we make that a less scary thing for them or a less negative impact on them? And how do we make sure that when we're working with these kids, our first result is not residential, right? We don't want to stick kids in residential. How are we going to really focus on the problem of which starts at home and building from there and having the resources and the supports in the home and our community that's going to be needed to address the issue at hand? So that's pretty much where we're at.
Yeah, sorry, I'm just taking all of this good information in too. I think our program is probably the most similar to like Al-Anon and Alateen, right? So we see definitely that our kids feel the like shame and stigma that we put on talking about substance use really impacts them a lot, I think too, because kids, while they struggle and they're not fully developed yet, they are that kind of like, it's very, not the best analogy, but they are still that like, they're trying to process and learn, so they pick up on those things, right? And so they pick up on the fact that so-and-so doesn't want to talk about it, or so-and-so over here has made a comment about it that feels really negative. They've picked up on those things and they internalize that as well, even though they're not the person dealing with the disease at the time. And so they feel really isolated, and we see that a lot, that once they kind of are able to come into the program and connect with kids, other kids, and sometimes their mentors who have also experienced those things, they really feel that sense of belonging and connectedness to something that's sort of like outside of school and home, and that has a big impact on them. I think trends as well, just the diversity of families that we see in our program really spans, right? I'm sure that's the same that you've seen. Like, we do have a lot of grandparents raising kids. We have step grandparents. We have step great aunts raising their family. We also have spouses whose other partner is away because of the substance use, either by incarceration or choice or sometimes death and overdose. And then we also have parents who are in recovery, who have found recovery and are maintaining recovery, and then are also still see a need in their child to come into the program because although they are now maintaining that safety, their child still dealt with that when it was active. And they still deal with a lot of anxiety and stress around setbacks or, certain triggers and things that are related to the trauma that they experienced. So, again, it just, it impacts so many of our families and just our community, and that they all need it. And we also often talk about how, like, the things that we try and work with our kids on are things that, any 9 to 12-year-old with a developing brain could really benefit from, right? Like when we're talking about regulation and trying to have them understand what that really means and what it really looks like to take care of yourself and communicate your feelings in an effective way, right? Like pretty much all of our middle school kids could benefit from some of that. And we're just lucky that we get to capture this group of kids and spend, hundreds of hours with them throughout the year. I will say too, though, I think Overdose Lifeline, right? We've, as an organization, are also looking a little bit more broadly, and this is not news to anyone, but just to speak to it a little bit, that obviously the prescription drugs and fentanyl and just the risk that incurs is just so much higher than I think any of us have dealt with on the forefront of drug use and experimentation in teens, right? Like, that's been around and has been a thing, and while of course we're trying to prevent and mitigate it, it's never been as dangerous and deadly as it is right now. So I think it is about, it can't be too early, and while we don't want to act like everyone is doing it, but I think having those teaching parents how to have hard conversations with their kids, and those very honest conversations, is something that we are trying to provide resources on as well, because we know that that's difficult to do.
Okay, thank you. So before we move on, does anybody have any questions, thoughts, comments on anything they've said? Lori?
I do have a question, just looking in our community where we have that youth who have had accidental overdoses, what happens, like what type of education components do you have for parents to have those difficult conversations? Because we see that is a struggle. How do I start this conversation with my kiddo without feeling like I'm accusing them, or how can we have that good, honest, open dialogue?
Yeah, I think that we've created some. I need to go back and find it, because that's something that's been on my mind. I think someone in our harm reduction team who's kind of connected to the schools here in Monroe County kind of heard about, that it had been a really heavy couple of weeks. And so I need to go back and see if we actually have that information, and I'll be happy to forward it on, because that was something that we had thought about before. It's happened in our community several times, right, in the last couple of years, and so trying to provide that. I think that there are resources out there if they can find them, but it's hard to ask someone else to do that. So I don't have a
On
great-
fentanyl specifically, there are a few like nonprofits that's been started by families who have lost a young person. Charlie's Song is one of those. And then I'm trying to think of another one. I as well can send information follow up. But that's May 7th is Fentanyl Awareness Day. And so I'm trying to encourage the schools to include PSAs, messaging, et cetera, on that day. And they have short snippets of videos. Sometimes it's just a video to educate what is fentanyl, because a lot of people still aren't as clear as what it is. I can't remember off the top of my mind if they have like a parent's guide or if it's more of just a parent FYI.
Okay.
But yeah, we'll make sure to follow up with those resources and
Good,
share.
thank you. And I just want to pass on some information that somebody that's sitting out here tonight gave me some information on an article about. In 2023, data continues to document stable or declining trends in the use of illicit drugs among young people over many years. However, more importantly, other research has reported a dramatic rise in overdose deaths among teens between 2010 and 2021. Which remained elevated into 2022. This increase, they say, is largely attributed to illicit fentanyl use, potent synthetic drugs, contaminating the supply of counterfeit pills made to resemble prescription medications. So they said, taken all together, this data suggests that while drug use is not becoming more common among people, it is becoming more dangerous. And I believe that's just in the community as a whole as well, and it's just kind of trickling down to the adolescents as well. Is that something you guys think is true or seeing as well?
Yeah.
Okay, okay. Any more follow-up questions?
I think one thing to note too about, fentanyl can be added to like anything, but with vaping specifically, right, kids may not be getting their vape cartridges or mods or whatever, right, from the store. They're getting it from somebody who's concocted I don't even know what to call it, right? Like their own recipe, right? And then they don't know what's in there. So again, we don't want them using any substances, but if it's just a vape, it's not as bad, and then they don't know what's in it. Yes. And that's too, if they just think they're taking an Adderall or just taking a Xanax, not knowing. So again, it's nobody's fault. Nobody deserves to die or get hurt by drugs, but they think they're doing the safer option, that risk reduction, if you will, in some capacity. But like you mentioned, it's just more deadly, yes. Right? Like when people our age and older experimented, it didn't have the same consequences that it does today.
Yeah. And I'll tell you, I'm oversee the problem-solving courts here in Monroe County, and when people end up, some of our participants test positive for a specific substance, they will tell us, I just took a hit of this guy's vape, not knowing that there was anything else in there. And how scary that is that they had no idea that there was something else in there when they just thought they was taking a hit of a vape. There could have been cut with fentanyl, heroin, something, who knows. But so you're seeing that same kind of trend among youth as well, right? Okay. All right. Any other follow-up comments, questions, or anything?
Really quick, I will just
Sure.
plug too that, I mean, I don't know that kids will be doing it. It would be great if they were. Those are conversations we can have. Overdose Lifeline also provides fentanyl test strips. Then they'll be mailed out just the same way you request naloxone, you can request test strips. Because so many people are experiencing it being in drugs that they're buying that they don't expect it to be in. So we're encouraging people to test. It is a little bit of a gray area. Some people struggle with carrying them because there are certain laws in Indiana that they feel like they could be penalized, criminalized for carrying it, but it's still harm reduction.
Harm reduction, sure.
I have a question about that. The nonprofit that you mentioned, the information that Monroe County Schools sent out is anti-test strip. And so do you find that there's mixed messaging around test strips? And so should we tell our kids to use them or not use them? And what is the correct answer with that?
I think the concern when it comes to fentanyl is if it's, let's say they test a batch and wherever they put the test strip, it may not be in that area, but it's in a different part. So it's not 100%, but it is one method that's out there. So I mean, it's better to do all the steps you can to be safe than none at all, but I think you can't fully rely on the strips to be 100% accurate. So kind of with a grain of salt, but it's all you have. But again, going back to that message of whether they're little kids and you start having the message of don't put things in your mouth that you don't know where they are, when they're older too, like if you are gonna use whatever it is, a vape pen, you buy it from the store and that's the only one you use. You are not sharing with friends, right? So that was harm reduction messages. If there is use, how do you do it in a really, really safe way and guarantee what you're taking is what you think you're taking? I know that probably isn't the popular answer, but just telling them not to do it if they're going to do it isn't helpful either, right? So does that answer your question about the strips specifically?
I just need to give that kids clear messages. Either
Gotcha.
use them or don't use them, but we can't tell them use them, but they're not really great. Correct.
I wish there was a better testing option as well.
Did you say there was somewhere you could get the strips? Because
Leah
I've
did.
never seen them anywhere.
Yeah, it's my understanding that you can request them from Overdose Lifeline. Yeah, I was like, yeah, just on our website.
Okay, thank you. Oh, Bruce has got a question. I'm coming to you.
Okay, now, the thing about fentanyl, my understanding is it doesn't matter where they put it. They put it on marijuana, and you don't know how much you're getting. See, that's the big thing about that. And it's really hard for me to get a grasp of that because, of course, I never did fentanyl, so I don't know too much about it. But I know that just a little speck could be the one that takes someone out. So do we need tougher laws on fentanyl?
I don't know if we're the panel to answer that question per se, but I think it's complicated, but I think increasing awareness of how it's different, right? I think we have some youth prevention education that we'll go and do in schools to talk specifically, like, not saying that these are fine and opioids aren't, but here's why it's different, and here's why it's more deadly, and here's what's going on with that, just so that they have at least some education and awareness and understanding, and letting people have test strips. That's our effort right now, and is because again, that's what we have, right, to arm the community in just hopefully saving someone's life so that they can then take the next step, right? We can't save them if they're dead, so, but I don't know.
True.
Yeah.
Okay, thank you. I told this individual I wasn't going to call him out, but I'm going to call him out because he's one of my cohorts at probation, Jeff Hartman, our juvenile probation supervisor. I wanted him to kind of comment to what he's seen coming through probation. Trends.
Well, first, Steve, you put an all-star panel together here because I can't really add much to what they shared about the trends that they're seeing on their end, because it's similar to what we see on our ends. We have great grandparents raising kiddos now, and coping mechanism, engagement strategies, and let's just be honest, kids experiment. We all experimented to figure out where our path was going to be, and nowadays it's just much more dangerous because sometimes it can be catastrophic, especially now with this fentanyl scare that we're all exposed to on a daily basis. And I don't think kids understand the seriousness of some of their choices. And unfortunately, some of them it's too late, and fortunately, some it's not. But I think it's incumbent on all of us to educate, and every time we get a chance, educate. That's the only way we're going to tackle this situation we're in.
Thank you. Okay, can we move on now, unless somebody asks something else here? Okay, next question, or next anything we want you guys to comment about is, how could the community help you or your organization as far as the misuse of substances among adolescents? Kathy, you want to go?
Well, I'm also the outreach coordinator for Al-Anon, so I go out into the community and do a booth with information, and so I'm constantly shocked at who's never heard of Al-Anon. I'll ask it as they walk by, have you ever heard of Al-Anon? And they think it's Alcoholics Anonymous, you know, where people go to help get off drinking. And I say, oh no, we're support for family and friends of people with alcohol use disorder. They, oh, we don't have that in our families. You know, and I would say 50% of the people I ask have never heard of it. So that's just a fact. And then when I say something about Alateen, they're not aware that that's something that they would be interested in. And I think for a lot of people, it's, I mean, I just went to the AA conference here in Bloomington 2 weekends ago and discussed this with some of the folks. And I realized that it's a big deal if you're in recovery to face the fact of what your substance use has done to your family. And, you know, I had 5 women who came up and asked me about Alateen, and I explained to them what it was, and every single one of them had shame. And it was really hard. I said, you're in recovery. You're doing the right thing. You're talking about it. I said, do you realize how important that is to bring this up and to tell your kids, you know, that you are on the right path now? And I just think it's really hard for people to know about it. So if you have any place you want me to go, and I'd be happy to visit to provide information. I've been to the school systems. I mean, I feel like I go everywhere, but I'm definitely open to that, as much as also just getting the word out to kids that Alateen's there. Because I think a lot of kids aren't aware of what's going on in Alateen. And there's also kind of a thought that since we talk about the 12 steps and they all say God, that they have to believe in God. And just FYI, you know, it's a spiritual program. It is definitely not a religious program. And I think it's really important for kids to know that they can, a lot of people are mad at God when they come or don't believe, and that's perfectly acceptable. For many kids, they don't have any relationship with a higher power for quite a while. And that's not uncommon in Al-Anon either. So I just don't want people to think that they can't come if they don't believe. And I think the other thing is that we really need the youth, because this program is going to wither if we don't have kids come. And the one thing I will say is parents cannot come to the meeting because of anonymity, and this is the time for the kids, but they can stay at the library, you know, so they don't have to feel that their kids are going off into the dark world of who knows where. But I think it's just important for them to also know that if they have any questions, we're there to answer them. And most of the time, they're feeling a lot more relief after they've met us and understand what's going on. We have literature we give both the kids and the parents, so I think it's an important part for them to get to know us better. But yeah, I think that's the biggest thing, is the confusion between AA and Al-Anon, and then just not getting the word out to people in general, that there's a program that can help you. It's free.
I think for me, just with me working with school-age youth, I mean, I do my best to be on coalitions and committees and know what organizations and support is out there. But you're always welcome to contact me or colleagues to let me know about new things, and I can help, pass that on to the schools. But I think just in general, from a community standpoint, what we can all, I think, do better is, again, don't be scared to talk about it. Be that askable parent. So no matter what behavior it is, your kid feels okay to come to you and not going to feel like, oh, we don't talk about that in this house, or you're going to be punished for it. So whether you have a young person in your house right now, or you're a relative or a mentor, just be that safe, trusted adult, because you could be that only one in that kid's life. So just knowing your own, kind of the whole, you might not see what comes of it, but you're planting a seed, you're being there for them when they need it the most. So I think that's something, right? Adults, you're scared to death every day for your kids in this world, but it doesn't mean you can put them in a bubble and ignore it and things are gonna go the way you want it to. So have conversations early and often, build that rapport, build that relationship so they can come to you even when they're struggling or in trouble, and know that you're gonna help them through it.
I think it's harder for DCS than what they've got clearly. I think for us is, we've got the stigma with what comes with DCS. So I think really it's just continuing to educate. Don't be scared to ask for help. Even when knowing that DCS is not just a place to call and report abuse and neglect, it's also available to call the hotline and ask for help. It's okay to do that. You can ask for a family evaluation. Families are able to. It doesn't mean that we're going to come out there and take your children. It means that you may have kids that are struggling with their identity, with drug use, with all of these things, and you don't know where to go. I mean, it is an option for the community members or even people that they may know to call and say, hey, I have a family, they're struggling with their kiddo, they're doing everything they can, but they just need help. That is a resource that a lot of people don't know, that because again, it just goes back to what we're really known for, right? But that is an option for people to know. And I think it's just, again, like you said, don't be afraid to talk about it, educate, and it's okay to reach out. And because a lot of times with us, we're getting you on the back end, right? We're getting kids on the back end, and we're causing more trauma, right? Because to kids, and we don't want to do that. There's things that we have to do though, right? Ensuring kids' safety. But like I'm saying though, to be more of on that proactive side of things is just, like I said, utilizing that resource of calling the hotline as an ability to say, I need help.
Can you talk about what you feel the hotline number is?
Yes.
Can-
1-800-888-5556. So you can call and say, hey, I need help. I'd like to have a family evaluation. Send somebody out, talk with you, find out what the things that are going on, and help provide resources and build a team around them to help support them to prevent any type of future intervention or something else happening. So it's something that we do have available so that we can be more proactive on that side of things.
Are you all connected with 988? So if they called 988 saying that same thing, would they then send them to you? Or
No, they would have to specifically call the actual DCS hotline. That's the DCS state hotline, yes, ma'am. It's been a while.
It's 800-800?
800-800-5556, sorry.
Leah, can you speak to how the community can maybe help you and/or your organization?
Yeah, I mean, we're still relatively a new program in Southern Indiana / Mitchell, Bloomington, Bedford, Paoli area. Those are kind of our hot point focus points that we're trying to make sure that the community knows that we're there and available. So things like this, we love to be invited to speak about the program. So if you have things that you would love to invite us to, meetings, Centerstone group meetings, staff meetings, things like that, just so we can come in and talk about a little bit about what we do as a resource to families. We also still have room for more mentors in Southern Indiana as well. So if you're, I mean, I know probably most people in this room are pretty strapped for time and do a lot of hard work on their day-to-day. So I don't know, but it can be sometimes, I find too, that it can be a little bit refreshing and rewarding to like get in there and like have so much intentional time with our kiddos. So like spending 4 or 5 weekends with them, while it's a lot out of the year, it can be kind of fun to like have that time, because I know everything is so fast paced, services and all the things, right? Like we only have so much time to see them, to get the work done. So it can be, I think, kind of cool and nice to like spend that big chunk of time with only like, 10 kids. So yeah, that's pretty much it.
Okay. So let me just kind of elaborate a little bit on what you said. So it sounds like all 4 of you are saying educate, 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 correct? Which will hopefully help prevent down the road as far as some of this is concerned, right? Okay. All right. Thank you. Any other or any comments or questions from anybody here?
Hi, I just wanted to let everyone know that any of the naloxone boxes that are here in Bloomington, I believe that all of them have the fentanyl test strips as well. We can't put them in the vending machine that's at the jail based on funding source, but all the naloxone boxes have the fentanyl test strips as well as now xylazine testing strips as well.
Thank you. I can only assume there's nobody asking anything online. I don't know enough about Teams and seeing it. I don't see that there's anything up there, so I don't see that there's a chat up there at this time. Let me come to you. Hang on.
Thank you. I feel like I was rude when I first talked about the testing strips, because it's a political conversation and a tough one. And like I said, I think that message needs to be very clear for kids. And so if they need to be using test strips, let's tell them very clearly, use the test strips. If we say that the test strips provide what did I just say? False sense of security, thank you, then let's tell them not to use the test strips. But let's get the messaging down on that. But I wanted to say too, thank you for everything that you're doing for the community and for our kids. We really appreciate your efforts. Everybody that I've talked to about this over the last week has said nothing but positive things about the work that the community is doing, that the school district is doing, that you all and all of your groups are doing, so that I know that there's a lot of positivity about what you're doing. My last question is I know that this was about trends, and my impression is that teens feel like some things are not dangerous because when they go to the gas stations here in Bloomington, there are unregulated drugs that are available to them in the gas station and clearly marketed towards kids. So if you could speak to how the community can get rid of the nonsense that's happening at our gas stations, I would certainly appreciate that.
One thing to know, and this is kind of more tobacco vaping related, so the state has tobacco coordinators in a lot of the counties in Indiana. And so every 2 years, is it? They send 1 million people out in the community to go to every gas station, tobacco retailer, vape shop, whatever, and liquor stores, Kroger's, whatever, to do an audit of what they're selling, what's the price points, what marketing, is it at eye level, is it not? And that gets sent up to the state. From there, I can't speak to what happens, but I think the more pressure we can put on our folks locally, whoever that may be, legislators or people who make decisions, if they don't hear from us that it's a concern, it's an issue, nothing's gonna change. And I don't know what that looks like from like a business standpoint, like at what point can you shut someone down? I don't know if any of y'all can speak to that. But like you said, they're completely legal. So why would they not be safe? So it's kind of sending them a not great message too.
Good. Thank you. Any other comments, questions?
One more thing to maybe consider, because I've heard of some gas stations not carding kids, so report them. Yeah, just make a report of.
The question was,
Anyone
who
in
do you think the
government
best
have a
person is?
go-to?
The alcohol and tobacco use state, gets the license system for those.
Okay, thank you. All right. The last question I have for you all are, what are some challenges that you in your role with the population, or with the population you serve, what are your challenges with you or your agency?
Well, with Alateen, Alateen's been started in Bloomington before and has, just withered because of kids not continuing. And they do age out, but typically what I see is we'll have some kids come regularly and then just sort of drop off. And you try to follow up with them or what have you, but it is like herding cats. I feel like sometimes they don't have transportation, sometimes they don't have a parent that's able to provide them transportation, or they just don't have, they get tired and they're not sleeping well, so sometimes they just don't show. And I feel like rather than make them feel like they should come every week, it's about them and what they need and what they're getting from it. But I look back when I had teens many moons ago, and I grew up in a household where we didn't talk about drinking at all, and yet it was like the elephant in the living room. So I was bound and determined to sit down and talk with my kids about it. Like, these are the house rules. These are the rules that we live by to stay safe. And I said, and one of them is you don't drink, And then I said, but, the big but, if you find yourself in a situation where there's drinking going on, call me. Call me and I will come get you. I said, your safety and your ability to be okay is way more important than whether or not you break a family rule. And I furthered that with, I know that you don't always make decisions that are the best interest of you. I said, but it's critical that if you find yourself with a friend who's been drinking and is driving you home, that you do not get in that car, period. And I said, and don't ever lie to me. I said, you'll get in twice as much trouble if you lie to me. I said, call me and I will come get you. And, I had a little issue with the school system having zero tolerance because I felt like it impacted my kid who was telling the truth a little bit more. I grew up in Bloomington, so I remember what was going on back then. It was definitely not zero tolerance. So I just feel like there's some wiggle room that can be utilized for the kid's best interest. And that's obviously up to the principals and everyone to decide. But I think kids need somewhere to turn to. And it should be our parents. It should be someone that they can trust, that they can tell the truth to if they're scared or if they're in a situation over their head. What are they going to do? And they're not going to get sunk. But I do feel like that as a parent and growing up in a house where drinking was rampant, it was scary. And there were things going on in that house that I wished I could have talked with somebody like an Al-Anon or Alateen too. And I just think it's really important that there are adults out there that they can talk. My kids' friends came to talk to me, and I found that because I was the askable one, that they would open up. So I just feel like, we were all kids once, it's just, that's just the facts. So with that, I pass. Yeah.
Do we know, I know with adults, if they have, like, for example, Medicaid services, they can take Medicab to support, like, AA, NA. Do kids have that same ability, or, because I know at one point there was some question about could a child ride in a Medicab alone, and I thought they had kind of made some exceptions. I didn't know by age if that might be a transportation option.
Yeah, I don't have the answer to that question. We will pick them up as a sponsor. We can pick a kid up. It's just that they don't think ahead so much. But like, I always wait after the meeting because parents don't show up at the right time to pick them up, and I never leave a kid alone. And I tell them that too. If you need to talk, you can call us. But they're kids, so.
I think one thing we forgot to mention briefly around educate, is letting young people know, like, is it Aaron's Law, about how they can call if we're concerned of safety or life, and you're not going to be held responsible for that event. So letting peers feel empowered to stand up if they're that bystander, if they're concerned about somebody's life while using. So we could be doing better education there too. But what was the question? The
Challenges that you, with your role in your organization.
Okay, so one is just underdeveloped brains. They think they're invincible, nothing bad is ever gonna happen to them. That's just the population we work with. But then I think from my perspective, from kind of the school health approach, I'm gonna get on a soapbox for just a little bit and then get off. Indiana as a whole, we don't do great when it comes to education or public health. And I'll star that, caveat that this year we got more public health funding, so there is gonna be more efforts within our local health departments and communities, which is wonderful. We're so excited about that. But when you look at a state who has awful health outcomes, and then you don't require things like health education to be taught in school, if they're not learning, how are they going to make better choices? So I wish that there was better accountability around health programming and health education and building those health-related skills within our K through 12 setting. So it's not something that's specific to Monroe County. I think actually our schools are doing quite well, but when things are not required or tied to the standardized test, they're not going to find time for that. And schools are strapped for time and people, right? They don't get enough funding or time. So I guess when we are coming to them and asking them to do more programming, more education, we need to kind of just be mindful of what we're asking and putting on their plate and finding ways to do that creatively, or we're coming in and taking that off their plate for them. So I guess just working with just the schedules, the requirements, the priorities that school have, sometimes it's hard to get in, and it's not a fault of their own. It's kind of this bigger picture of the state. Because they have other priorities or other things that they need to check off or do, and health is often not on that list. Yeah.
I mean, mine's pretty simple. Just being DCS in general is pretty much the biggest challenge. I mean, it is. I wish it wasn't that way, but it is. And I think what would be helpful really is being a face out there more, making sure the people that we're working with, that we know that we're all going to be collaborating with, have a more positive take on what we can do. I mean, I know it's hard. There's a lot of things DCS does well, but I know sometimes on the news all we see is the things that, the negative things, but there are a lot of great things and opportunities and services and things that we've done over the years to help with families. And sometimes we are that outlet. I know parents, don't talk to DCS, but sometimes we are that outlet for them to talk to. And I know sometimes that's hard, but we are able to be that outlet, and we're able to utilize that to kind of help the parent understand what it is that their kid may be struggling with. And it just kind of goes back to, just like I said, all of the community partners that we work with, and they know if they're going to have DCS involvement or they already have DCS involvement. It's really just educating them on like the opportunities that they have with us. It doesn't have to be a negative outcome every time.
Thank you.
Yeah, I think definitely one of the challenges that we've had in our Southern program, I think some of it's natural, like being housed in Indy, and like that's where my office is, right? Sometimes I think there's just like a disconnect between me and the community we're trying to serve because we just aren't there all the time. And so I think our persistence is starting to help that and break down some barriers, and just traveling down to things like this, and we're going to Bedford tomorrow, and we've spent time in Paoli, and so just consistently trying to like be a face in the community so people know that we're serious about showing up and assisting their families. But yeah, I think that's been the most challenging thing, and I think in general, right, like the difference between being in Indianapolis in a slightly more urban area and then working in rural areas, the conversation just looks different. There's a certain, I think, anonymity for our families in Indianapolis where they get to come to this program, and like a lot of people still don't know. They don't have, it's not accidentally advertised if they don't want it to be. I mean, a lot of them I think are pretty open people, but again, that's just maybe like a difference in their life. And so for our more rural locations, it is just more of a complicated thing for them because there is so much shame and stigma still. And it's kind of one of those things that's like, maybe everyone knows, but we're still just not going to talk about it. And so me signing my kid up for a program is me sort of like admitting it to my neighbors and my friends and my community. So I think that that's really challenging, and we understand that. So I think just allowing, you know, all of us to be advocates for reducing the shame and stigma and talking about it as much as we can and supporting them and understanding that what we're here to do is not to bring them in and judge them, but to wrap around, to be a part of all of the services that they are experiencing to support their kids. Yeah.
Thank you. Looks like we got about 15, 20 minutes left, and I want to be cognizant of everybody's time because we appreciate you all coming and taking time out to do this. Is there anything that we have not discussed, talked about, that you wanted to bring to our attention regarding this subject tonight that we haven't asked or talked about at this point in time? Any of you? Anything in specific that you can think of that you want to talk about or cover? Yes?
I was just thinking that one of the important things that I learned in Al-Anon, and we try to get across to the kids, is that addiction is a disease. And we can not like the disease, and we can even hate the disease, but we don't want to hate the person. And that was a hard thing for me to conceptualize. I really believe we're getting better at that. I really hope that as we find people in recovery and we see those good examples out there, that we recognize that this wasn't something somebody grew up and said, I want to be an addict. It's not a moral problem. It is, you know, an addiction problem. And I really believe that there's hope in that, that we can get that message across, and that kids can find a little bit more wiggle room in that. And that's all I wanted to say.
Okay, thank you. Anybody that's here? All right.
Okay, this one should make a lot more sense. Okay, now, do people refer people to you, or how do they find you?
I was just getting ready, I'm going to plug it. She's got a pamphlet full of stuff over here, right here. She said she had some of it with her tonight, so.
Okay, that's what I need to know. I mean, how do people find
But those that are not here, can you?
Sure. If you get on the Indiana Al-Anon website, you're going to find Alateen meetings listed there. So you're going to see that ours is listed as Wednesday at 7:30 to 8:30 in the Monroe County Library. You're going to see the other ones throughout the state. And then I just brought also literature about Al-Anon, since we're hoping that their parents might be interested. And in fact, that's why we started having it at the same time as an Al-Anon meeting and an AA meeting, thinking, oh, the whole family's in recovery, yippee! But it didn't actually end up that way. However, we do see that we have a meeting every day in Bloomington for Al-Anon, and that's an important thing as well that you can get on the site. I brought literature with me for Alateen as well. If you want to take some back, you are more than welcome to have it. And I have my card, and I'd be happy to pass that on. And if you have any ideas about where you would want me to come to tell others about it, I'd be happy to do that.
Thank you, Kathy.
For us, the easiest thing to remember is Overdose Lifeline. If you Google them and you click through all the things, you'll eventually find us. We also do have our own website at aaronsplace.org. Or if you also, because if you Google Camp Mariposa, you might find some of the other locations, but then if you click through, you'll find Indiana as well. But Aaron's Place is our official website. Yeah.
Is that Aaron with an E?
Aaron with two A's.
With two A's,
Great
okay.
question, yeah.
Okay.
AARon.
Thank you.
.com. I also will say that, I don't know if I mentioned that our program is free to families all year round. We also do family days in between camps, so we try and invite them to do fun things together as a family and spend quality time together. We make sure we write letters to our campers in between camp just to like increase that connectedness. And all of our campers on their first camp of the year will get a sleeping bag, backpack, blanket, all that kind of stuff. So hopefully all they need is to show up with appropriate clothes and footwear, which is still sometimes hard, but that's all they need. And then we have also acquired a van for camp. Because I thought about that later. That is one of our challenges for sure, especially in, I think, southern Indiana, just because people are coming from greater distances, that transportation can be a real barrier to attendance. But so that's something that we're working on. We've acquired the van. Now we have to figure out kind of who's going to drive it and do that piece of it. But we're almost there.
Take rolling admissions, or they have to enroll by this time to start? Okay.
No, we do rolling admissions. Now that we've been established for a little while, we actually find that works really, really wonderfully to like kind of roll kids in incrementally, and then the kids who've been there longer can kind of, just kind of model what the camp expectations are. So we do start at like the calendar year and kind of work through our curriculum, but yeah, they can join it at any time.
Thank you. Any other thoughts, comments from anybody here tonight? And again, Kathy?
I just wanted to let people know that next fall, September 5th, that the SUDAC, which is a Substance Use Disorder Advisory Committee, is going to do an recovery-oriented workshop conference. And that will be at the Monroe County Conference Center, and we will be doing many, many workshops that we would love to have everybody come. We'll have more information out in the news closer to the event, but we're working on that now. And I'd also like to let people know that the public health partners, Monroe County Health Department, IU Health, Bloomington, Parks and Recreation Bloomington, and Purdue Extension and Monroe County Health Equity Council are working on the Monroe County Community Health Assessment right now. We'll be having focus groups throughout April. We'll have the information up on our website, and many invitations will start going out in the next few weeks. So we hope everybody will come, share what's important to them about health in the community, because we take that information back and put it together for a community health improvement plan and start working on increasing the health. So we'd love to have you come, so please look for that and come see us.
Thank you. Thank you. Anybody else? Before I let you all go, I'm gonna plug the CARES Board real quick. We are looking for CARES Board members. We've added a few recently, and we're very thankful for those individuals that have volunteered their time to be on the CARES Board. And Lisa, our coordinator, is here. I gave you her email earlier, but I'll give it to you again. It's llmeuser@me.com, correct? So if you're interested in becoming a board member, we'd love to have you send an email to Lisa, and she'll send you an application. And again, in addition to that, we are going to be rolling out our CARES Board grant application, hopefully within the next week or two. And Lisa will be sending that out. So if you're interested in that, email Lisa as well, and she can get that information to you via an email, okay? Did I miss anything, Lisa? Thank you to the Commissioner's Penny for allowing us to have this room tonight and be able to do it in person, in addition to online and streaming it. And especially thankful to the 4 ladies that are here tonight to bring your wealth of knowledge and commitment to the adolescents and the Monroe County community. Thank you very much for being here. We truly appreciate your time and effort to come do this for us, okay? Thank you very much. Thank you. Thank you. Thank you. And with that, I think we'll end the meeting. Thank you.